name's Scott Herbert. I'm an independent financial advisor and partner of Clarke Nicklin Financial Planning. We're based over at Cheadle Royal Business Park in Stockport. So private healthcare is basically on a referral from your GP. So you wouldn't go to your private healthcare provider if you've got a sore throat, the flu or a common cold. Basically what you have to do is to go and see your GP. The GP would take a look at you and recommend what course of action needs to be taken. So instead of them referring you to the NHS, you get referred to your private healthcare provider. I think there's two sides to the story. First of all, from an employer point of view. So from an employer point of view, first of all, for retention of your staff, to attract new staff, and furthermore, if your staff are unwell, that they're able to get treatment quickly and efficiently. So not only are they better, but they then return back to the workplace, which is beneficial. If we have individuals, a lot of individuals' concerns, because you can have protection through the workplace, you can take cover out individually, is to make sure that you or your family members are able to access treatment quickly and efficiently at private hospitals in your area, and you're not waiting on waiting lists. The bed shortages, you can get the treatment done quickly for you or your family to get yourself better. So first of all, cover through the workplace through your employer. An employer can provide a group private medical insurance scheme. So they can offer you that as part of your T's and C's. So the way that it works is the employer will pay the premiums for their member of staff to access private healthcare when it's required. It's a P11D, it's a benefit in kind. So for example, if the premiums were, let's say, £100 a month and you're a basic rate taxpayer, it would cost you £20 a month in tax. Individuals, it's very differently. You can pay either on a monthly basis or on an annual premium to cover yourself and your families with the money paid directly from yourselves. I was only speaking recently, actually a tradesman. His problem is that he had two slipped discs in his neck. Now he informed me, I spoke to him about private healthcare, and he actually said, I wish I would have had private healthcare. A slipped disc, two slipped discs in his neck, or collapsed discs, he told me was out of work for 18 months whilst waiting on NHS waiting lists to get the treatment done. So not only was he in a great deal of pain, he informed me he lost 18 months worth of self-employed income. He actually went then to a private specialist because he didn't have a policy, he didn't have cover, and he was quoted £16,500 to get the treatment, which money he didn't have. Yeah, I think a number of good tips are to consider. First of all, very similar to a car insurance policy, private medical insurance has an excess amount on the policy. This will generally range from £0, maybe up to £1,000 a year. So certainly what individuals can do, if they're wanting to keep the premiums down, but they want access to the private treatments and the hospitals, etc., you could look to have a higher excess on the policy. So you might need to pay the first £250 on a claim, but you have access to the policy. That will reduce the premiums down. The other thing that we'd always recommend to people is to shop around, go to the different providers and get the very best premium, the very best cost for the best quality of cover. Well, the first thing that we would need to do is to speak to you, first of all, what type of cover are you looking to take out for your staff? There are all different levels of cover that are available. That can include both physical health and also mental health options as well. What we would need to do is, if it's a company, find out who the individuals are that you want to protect, names, date of birth. Postcodes are very important as well, because the postcode will depend upon which hospitals are available in your area. So those are the main things that we would need. If we've got those details, we can then approach the largest insurers to get costs and terms and conditions for you. Yeah, I think what you do need to take into account is that there are different ways of medically underwriting these types of policies. From a full underwritten policy, where you would need to furnish them with all your health details, doctor's details, etc. What's very popular is something called a moratorium underwriting. What that means, the basics of it, is any ailments you've had in the previous 5 years are automatically excluded. So if you've had problems with your knees, they will exclude that from the previous 5 years. If you've been on cover for 2 years and had no reoccurrence of the knee problem, it is then covered moving forward. So there are different types of underwriting options which are available, which you need to consider before you set up a policy.